In 2021, the AECD ranked Mooroopna the lowest amongst Greater Shepparton communities for children's vulnerability on one or more or two or more domains, including language and cognitive skills, with just 64.4% of children assessed as being developmentally on track. The Oral Language Intervention Program utilises a range of oral language evidence-based interventions to improve the oral language and literacy outcomes of students in Greater Shepparton.
We started the Oral Language Program about 5 years ago. We're really concerned about our students coming into prep and how far behind they were. One particular year we screened our prep students, our class, and 22 of the 24 needed speech intervention. So from there, spoke with Melbourne University and we hosted a couple of students, and it just worked really well. So the following year we employed our first speech therapist, and it's just been magnificent. So our students are still coming in at a really low level. However, the rapid increase in their data from the start of prep to the end of prep has been magnificent. So probably one of the best programs we've done at this school, and we've seen great results, and it started to roll out in other schools, which is good to see.
So we've got a community hub on site here. We get parents from children who are at this school or carers, but also just generally in community. People come in, they run things like playgroups in conjunction with other local organisations, and it's just an opportunity for me to actually demonstrate the strategies that carers can use at home for oral language. It's also an opportunity for the parents and carers to ask me questions if they've got any concerns about their children's language development, and we can then refer them to places in the community where they can get help early on. Being able to read it's really essential for functioning in everyday life. All the research tells us that we need to start where we're recognising that letters make sounds blend together in a word, and that we can actually read the words off the page, and then we move into working on comprehension, so understanding what it is you're reading.
Our Maternal and Child Health Service at Council is part of the Victorian statewide Maternal and Child Health Service. We are a free service that is available to all families with children aged 0 to 6 years of age, and we are there to help support and advise and work with families a healthy start for their child. Our maternal and child health visits tend to focus on the child's health and development. So within that, we will look at the child's growth, their feeding, and what developmentally they're doing at that stage. We typically see families on 10 occasions from when the child is born up until about 4 years of age, and they're our routine visits, but we can also see families in addition to those visits.
The Greater Shepparton Healthy Child Co-Design project was identified because we have really fantastic maternal child health services here in Greater Shepparton. However, it was identified that there was a bit of a gap and we weren't accessing our multicultural families quite as much as we would like to. So this project was designed to try and fill those gaps and to ensure that our maternal child health services are much more aligned with our multicultural families and are accessible for them. The Greater Shepparton Foundation was really thrilled to partner with both the Pratt Foundation and the Beeson Foundation to receive the funding to be able to undertake this really critical piece of work here in Greater Shepparton to support our multicultural families to gain access to our maternal child health services.
We'd like to thank our partners, Greater Shepparton City Council, for supporting us in activating this project, and we look forward to sharing some incredible results in the coming years.